Hi, so today we're going to be talking about Mind the Gap, which is the handbook of clinical science in black and brown skin. I'm very conscious of time, so we're kind of going to speed through this, but hopefully you'll be able to get a gist of what is going on. So this is a little introduction about everything we're going to talk about today. I have started with this slide. For those who don't know, the girl in the middle of this picture, her name is Victoria Climby. She was a little girl who unfortunately died in the 2000s due to abuse from her parents. She presented to a hospital and she was diagnosed by doctors to have scabies. However, this was actually early warning signs of abuse, and doctors actually misdiagnosed her, and then she ended up dying. On the top right, we can see the stat, which is black women are 5 times more likely to die from childbirth. This is a stat which has been prevalent for many years, and it's been prevalent for about 40 years. So this is kind of highlighting some of the healthcare disparities that currently exist. We saw with COVID-19 how BAME individuals and black people were more likely to die of the virus, and there's a whole host of reasons as to why they were likely to die from the virus. However, me personally, I think part of the reason stems to the fact that we are not adequately trained from the get-go to even diagnose and identify some of the signs and symptoms in black and brown skin. And in the top left, we can see the study which found that black patients are half as likely to receive medication as white patients. This is ideologies which actually even stem from the time of slavery, where they believed that black people were inferior and had nervous systems which are less developed, which has shown that some of the biases which currently exist in medicine today have stemmed back from many years. This is a slide of actual guidelines which were given out by the Royal College of Pediatrics during coronavirus. As we can see in the middle of these guidelines, which is an urgent warning sign for help, is that it's stating about going blue around the lips. However, how appropriate is this descriptor for darker skin? This is a slide. It might not make a lot of sense, but this was actually research which was carried out by a senior manager in NHS called Ade Adebayumi. If you can see in the bottom right of this screenshot, this is actually at -10% zoomed in. However, I've still got loads of room to keep scrolling down. So this is an analysis of all the conditions on the NHS Choices website. And he found out of 1,007 different conditions, not a single condition was in darker skin. So this brings me on to what exactly is Mind the Gap. So Mind the Gap is a clinical handbook of signs and symptoms in black and brown skin. The inspiration came from a range of life events, such as seeing the lack of patient confidence that members of my own community. And when getting to medical school, it became apparent to me that there was a lack of teaching on darker skin. And I just didn't see why almost medical care was being compromised due to the color of one's skin. When I say compromised, I mean in the sense that we cannot continue to say, oh, look for blue lips or look for pallor or look for redness, because sometimes these descriptors don't entirely apply in someone of darker skin. I think one of the most important things about my work is I'm hoping that people are able to unlearn some of the biases that they might already have, or if they already have them, I'm hoping that they're able to learn to be able to identify different clinical signs in black and brown skin. So a little bit about the journey thus far. This project actually started in December last year and we finished in May 2020. I posted it on my social media on the 18th of June. And since then, the post has amassed over 300 million impressions. And I can even guesstimate that that number is probably even greater than that at the moment. It has been featured in ITV, BBC, Sky News, BMJ, Newsround, The Washington Post, Fox News, ABC, and Disney TV. Loads of people always ask me, so like, why now? Why is this being brought to attention now? And I think these issues have been prevalent for many years, but often people are almost being silenced or not given a voice enough to be able to speak. And I hope my work empowers people to almost regain that voice or even just lift their voices higher. I think the year that we've had in 2022 is also further evidence that people are now starting to see the cracks which are in some of the systems that are in place. This is an extract from a conversation which happened in the House of Lords on the 14th of July. As you can see, the in the House of Lords, they're trying to address the government to ask them what are they doing to tackle ethnic diversity, because it is clear to see from my work and other people's work that the teaching that is currently there at medical school is not adequate enough to address some of these problems. So the members of the House of Lords were looking to get different organizations such as the GMC, Medical School Council, to provide a statement or provide some action on what they're actually doing to address this. One method which I think is so important to all of the work, like all of this work almost means nothing if we cannot assess the impact. So a way that we assess the impact, we carried out a training program at my university for this work. Prior to the training program starting, 71% of students disagreed that they could identify pallor in black and brown skin. And pallor is basically, to simplify it down, is just going pale. And this can be indicative of things such as a lack of oxygen. So for 71% of medical students between third year and final year to not be able to identify that, that is very concerning. However, after our 1.5 hours of training, 66% agreed that they could now identify what pallor looks like. 99% of the students agreed and strongly agreed that they felt more confident in creating a more inclusive environment. Myself, I cannot have all the answers and solve all the problems everywhere. However, if we're empowering other students to be able to feel confident in creating a more inclusive environment, it will do everyone good. And 99% strongly agreed that they could inform the lead tutor if material did not appear inclusive. This, like I said before, is so important because if we're not raising these issues, it feels like these issues will just exist for generations and generations. So my personal advice, this is because I'm aware that some aspiring medics are even watching this presentation today. Part of my personal advice to even making a change or just going through med school is that start where you are. Like, a lot of the time, Rome cannot be built in a day. I think everyone should take that first step today, whether it be something as little as just focusing on your happiness, so that when you eventually get to the time where you want to carry out a bigger task, you're mentally stable to be able to do so. My second piece of advice is realizing your worth. I feel like too often as aspiring medics and current medics, we look at ourselves and we say that, oh, we cannot do X, Y, Z because, oh, I'm only a medic, I'm not a consultant. I believe that you're never too small to make a change. And one thing as medical students, you're all experts to a particular extent in your field, because if you give the example of like when you went home from medicine in first year, all your parents and all your family were asking you for medical advice. So people actually see you as an expert. So it's important to realize your worth. Following on from that, you're never too small to make a change. My fourth piece of advice is be fearless, get comfortable being uncomfortable, because I find that fears are things that people run away from when they're afraid. So don't let your fears get comfortable in your mind and manifest. I think getting comfortable being uncomfortable allows for personal growth, and it allows for a lot of changes to be made. And unlike if you let these fears manifest, they will trap you from the very beginning. Myself, I was also scared when I was taking out stuff like this, but I think sometimes it's about taking that leap of faith, which will help you and propel you to where you want to be. My fifth point of advice is learn from your L's. Learn from your L's means learn from your losses. I think learning from your losses is so good because it helps you to analyze where you are, how you can do better, and how you can go forward. Myself, I was actually rejected from medical school 4 times before I actually got in. So learning from all of those different rejections helped me to mold the person who ended up getting into medical school. And my final piece of advice is make sure you write things down. I think sometimes we can let too many things clutter in our heads, and writing things down allows you to be able to almost take some of the things out of your head and see it from almost a third person perspective. Just before I end, I have included this poem, which is a very powerful poem. And to me, it highlights the importance of why some descriptors that we use at medical school currently don't necessarily apply. I don't think I have enough time to read it out, but I hope everyone at home has managed to read it very quickly while I've had it up. And on my last slide, this is actually an exclusive for about the 650 people, I think, watching this right now. Mind the Gap is more than just a handbook. If you scan the QR code on the right, it will take you to this website where you can sign up and you'll be able to get all of the latest information when Mind the Gap does eventually come out. Because at the moment, we're working on the best way to distribute it worldwide. So if you scan the QR code, or if you can't scan the QR code, visit www.blackandbrownskin.co.uk and you should be able to sign up. That concludes my presentation. It was short and sweet because I only had 10 minutes. But if there's any questions, I'm happy to take any questions.